At this time, we're going to demonstrate a needle cricothyroidotomy. A needle cric is performed on children. The indication is for children 12 and under. In this age group, you would not be doing an open surgical cricothyroidotomy. The recommendation would be to do a needle cricothyroidotomy. Once again, we want to learn this skill with equipment that can be found almost anywhere, and minimal equipment. We don't want to learn this skill just with a kit that might not be available. The other thing that comes up is the need for a jet ventilator, which people might not have available or might not know where that is in an emergency. So we're going to learn how to do an emergency needle cric with minimal equipment so that we can attach it to a BVM. So there are different options for the needles. This is an example of a 14 gauge IV that has an angiocath. And when you open it, you can see the angiocath on the needle, and it has this little adapter on the end, which you would want to remove so that you can attach a syringe to the end of this needle. And then you'll be able to pull back on the syringe and get back air to see that you're in the airway, and then be able to slide in with the angiocath. If you have a 14 gauge IV with an angiocath, this would be ideal. The other angiocaths that people might see are these IVs that are protective. On this, there is a needle and an angiocath, but it has this protective component. And this would be where if you were getting IV access, you would slide this forward. But what you can notice is there's nowhere to put a syringe on this. So if this is all that you have, you can use this, but know that you can't attach a syringe, so you won't get the feedback of seeing air enter the syringe. But in an emergency, you can use the protective IV without a syringe if needed. Now once you have the angiocath in the airway, what do? Because you can't attach this to anything, and as we said, we want to learn how to do this without a jet ventilator. So we're going to have this inside the airway, and basically we can take a syringe. Here we have a 10 cc syringe, but you could use a 5, a 10, or a 20. And if you pull out the plunger and attach the syringe to the angiocath, then you can take your endotracheal tube and put it in to the syringe, and then you can inflate the cuff, and then you have your endotracheal tube in the syringe, and then you have your angiocath, and then you can attach this to a BVM so that you can at least start with getting some oxygenation in this emergency in the needle cric. So let's now demonstrate this procedure with all the steps. Once again, this is for a child under the age of 12. So we're going to have our angiocath ready with our needle, and here we're going to demonstrate the angiocath where we can attach a syringe to the back of it. We're going to set up our syringe again, and remember it can be a 5, a 10, or a 20. We have our syringe here, and on this situation I am a right-handed surgeon, but because I'm doing a needle cric, I want to stand on the left side of the patient. I'm going to feel my anatomy, and I can feel again the sternal notch, the trachea, the cricoid cartilage, the divot of the cricothyroid membrane, and the thyroid cartilage. So I'm going to use my left hand to stabilize and feel my anatomy throughout. Then I've got my angiocath, which I'm going to insert at a 45-degree angle into the skin. And in a real patient, if you start drawing back here, there will be nothing in the syringe because you are in the tissues between the skin and the airway. But you'll draw back in a similar fashion to placing a central line, and you will go forward until you enter the airway and see air fill the syringe. Now I'm in the airway with the needle. So I'm going to slide the angiocath forward into the airway and remove the needle. Then I can take the needle off, take the plunger out, and attach my syringe to the angiocath. Then I got my ET tube ready, and I'm going to insert my ET tube into the syringe, inflate the cuff, And then I have my angiocath, my syringe, my ET tube with the cuff inflated, and then I can attach the ET tube to a BVM in order to start to oxygenate the patient.